Господин доктор. Okay. So that was very interesting, Richard. Now, can you tell us a little bit about what are the actual applications of mindfulness-based therapies in psychology and in medicine?
Okay, Alex. Well, I guess following on from the program, which is called Mindfulness-Based Stress Reduction, that's the program that was run at the hospital for the chronic pain patients. And this discovery that actually, as well as treating pain, it also had benefits for anxiety, depression, stress. From that has come a whole sequence of different therapy models. One of the first was mindfulness-based cognitive therapy, which took elements of mindfulness, just this capacity to bring your awareness into the present and accept whatever's happening, and combined it with cognitive behavioural therapy, which of course is basically the treatment of choice for most psychological disorders. Mm-hmm. So it's now about, so MBCT is about identifying and recognising thoughts as they come up and knowing which ones are likely to lead to depression, but rather than having to change them or reevaluate them in any way, just accept that they're there and not buy into them. Mm-hmm. And there are a whole raft of other psychological interventions that have come since then that are based on mindfulness. Okay. And so it's now being used to treat, it's not a silver bullet, it's not a panacea, but it's being used to treat most psychological disorders. There are even pilot studies which have shown that it's effective for treating active psychosis, obviously depression, anxiety, smoking, eating disorders.
So it sounds like it's been applied both in the kind of more mild end of the psychological difficulties as well as the more severe end of psychological problems such as psychosis.
Yeah, absolutely. That's enough, I think. Yeah. That's pretty good.
So this is the end of the interview?
I think so.
Okay, so I'll cut this bit and then we'll have this next bit where I'm saying thank you.
Yeah, is that okay?
If there's no more questions.
I think that's it for the questions. Yeah.
Yeah. Well, that was a very interesting short introduction to mindfulness. Richard, thank you very much for talking to us today about this. I'm sure that people will be very interested in exploring this topic more because it's a very, very fascinating technique, which, as you're saying, clearly has been around in different guises over many, many years, but it's clearly been now introduced in a more structured way into mainstream sort of psychological work, which is fantastic.
Absolutely, it's an exciting time, I think. Thanks for having me, Alex.
Thank you very much for joining us today, Richard.
Okay, so I mentioned already that we do a practice.
Did you?
Yeah, this is the very start.
Okay.
Did we want to do that in the wrap-up? Just to say thanks for coming today. It's been very interesting talking to you. Maybe you want to give...
No, because we said we're going to have for people who are not interested, we're going to have the practice one as a separate video.
That's right, yeah.
So
do we want to introduce it in this? Do we want to mention it in...
No, we'll just introduce it now at the beginning of this.
Okay.
Now, I don't know how long we had for it last time.
3 or 4 minutes, yeah. We've probably got long enough if we do it here.
Just double check it.
Yeah. How long have we got?
So it's been 4 minutes now, which means we've got 4 minutes left.
No. Not unless, yeah,